I'm here today to talk to you about the Research Delivery Network that you will hear me refer to as the RDN as we go through this. So I won't hang around on the next few slides for very long. It's just to give anyone that doesn't fully understand what the RDN is a little bit of background before I have a few examples to share of how we work in community settings. So the RDN transitioned from the Clinical Research Network towards the end of last year, also known as the CRN Wessex. And we did this transition nationally from 15 CRNs to 12 RDNs to meet the developing needs of the health and care system. So the RDN's purpose going forward is one of the focuses is that we extend research more into community settings to work with more communities and those community organisations. And one of our focuses is to extend research opportunities to more of our communities and our public, because at the moment there is a lot of people that is underserved by research opportunities. So this is one of our key focuses going forward. And this is my last generic slide on the RDN. So I am the head of research delivery and support for out-of-hospital settings. So that includes primary care, community research, and lots of others, such as hospices and care homes and so on. And I am based in South Central, so that is the I, the little grey bit on the map up there. And so part of our geography that we cover is Hampshire and Isle of Wight, and then Wessex then splits over South West Central as well. So Chris Voisey is my colleague who works at the RDN in my role in South West Central. And he covers the rest of the Wessex geography. Now, what's really important to us over the two regions, the two RDNs, South West Central and South Central, is that we work together to support research in the Wessex setting, as well as within the two geographies that we have. And that's echoed by RDN leadership nationally and the Department of Health and Social Care, that we are, even though we are 12 regions, we are one RDN and we work together. So it's really lovely to be here today and be included, so thank you, Christine. And both of the regions, as the other regions have, we have a range of specialty and setting leads. So these are experts that know their areas well, such as residential, covering hospices, care homes and prisons, as well as social care leads, public health leads, community, primary care and GP practices. So we're working closely with them as they are with you to understand how we can better support research in community settings. In South Central RDN, I wanted to introduce you to a research delivery team that all the RDNs have access to and are developing their own teams to deliver and support research in community settings. So the idea is that these agile teams, we've got about 30 in South Central at the moment, working in the Hampshire and Isle of Wight region, work across typically non-traditional settings where we see research activity happen. So they are working in hospital settings, but they're also working in GP practices and care homes, hospices, and we're starting to support research in pharmacies, dentists, as well as participants' homes that take part in that research. And part of that team as well is also looking to engage with the public, raise awareness about research and how we work with other organisations in the community space. That support is offered to studies that are on the NIHR portfolio. You may have mentioned it earlier. There is an eligibility around studies getting onto the NIHR portfolio, which we then support. We all know within the RDN about the eligibility of what studies can go on the portfolio, so please do come and talk to us at the RDN and we'll be able to sort of help you through that process. But we also want to work with communities and organisations that might not have studies on the portfolio but are looking to develop their research capacity and capability within their organisations, or increase awareness of what research is, changing the culture. So for example, there's many of you that I've been speaking with over the last few months about how we do that. So it doesn't have to be about a study, but it's about us learning about what research is happening within the community space and how the RDN fits into that and supports it. Does So I just wanted to share with you a few examples. I've got two. The first one is the care home Laurel House in Southampton, run by Felicity Dennis, who you can see up there. And the Agile team went in to help Flix deliver the study in the care home last year. And it was really an amazing experience and great learning for the Agile team working within the RDN. And that care home research was part of a greater NIHR enriched network that some of you I'm sure will know supports research happening in care home settings. And then the other example I wanted to show you was a Southampton General Hospital run study, the IDX lung study, looking at how to better improve diagnosis for lung cancer. So the Agile team from the RDN took out a bus basically for that study, completely independently operated it and managed all aspects of the study delivery. And as you can see from the lead of that research study, talking about how helpful it was to have the Agile team working on the bus in car parks around the place, recruiting people and making it more inclusive. Okay, so this is the Agile team I've been talking about. There's a variety of roles on there in that team, from nurses, clinical research practitioners, and so we've got midwives. I think we've even got one pharmacy technician from previously. So they will kill me for sharing that photo, but it's a lovely photo of them all. And one of the key things that they've got a great history of doing in Hampshire and Isle of Wight, as do the other RDNs, is working within primary care, particularly in GP practices. So in Hampshire and Isle of Wight, is the example I'm going to give here, is that the team has gone into a variety of GP practices. We have about 50 of them in Hampshire and Isle of Wight, and they help staff set up studies, deliver those studies, recruit to those studies, and close down. They also provide lots of guidance and support through mentoring, and they also connect different GP practices, maybe with those less experienced, with those more experienced. The team also goes out and does virtual and face-to-face practice visits, and they attend practice meetings to give research updates before. We have an annual regional conference. We've actually got one next week for South Central, and where we provide GPs and GP staff, practice staff, with lots of information, updates, and a chance for them to network. And all of this is underpinned of the Agile support and work that we do by the research, the RSI, site initiative, research site initiative scheme that is supported by office staff based around the RDNs. So this is my last slide, and I just want to say that at the moment the RDNs are learning how we support and fit into the community, and we're really interested to understand how we can work with you as organisations, how we can achieve greater impact and collaborate with you all. We don't want to duplicate what's already happening or recreate the wheel when there's so much expertise already out there. So we're here to learn, and we really want to talk with you all and develop all those relationships to understand how we can work with you. Okay, and this is just a final quick nod to the RDN involvement, engagement and inclusion team. Each RDN has this, so will South West Central. And this team of Kerry, Kirsty and Zoe in South Central are looking to broaden research inclusion and look at innovative ways of engaging with the public, raise research awareness. So we're all working together in that field. So there's another team there to provide their support, as there will be in South West Central as well. And I think that's everything from me. Thank you.